Hi everybody, I'm Lori with Behavior Education LLC, where I do animal training and behavior studies. And I also am the director of Spirit Keeper Equine Sanctuary, where we also take in other animals from time to time besides just horses, including dogs, cats, chickens, goats, snakes, potbelly pigs, etc. I'm talking to you guys today to update you about our outreach snake, Hank. And also just to share his journey with you, because this might be helpful for other people who are noticing things that are out of the ordinary with your snake's health or medical condition. So Hank has been with us about 8 months. We got him in October of 2018, and he is an 8-year-old Morelius Belota McDowellii. He's a coastal carpet python. He's an adult male. And he's very, very docile. He's been a very mellow guy since we got him, and we got him specifically to do educational outreach with so that people could interact a little bit with carpet pythons. And he wasn't a particularly active snake when we first got him, but he learned that it was enjoyable to come out of his enclosure from time to time and use the exercise area that we have set up, which is a lot of things to give them physical stimulation, use their muscles for climbing, where they can stretch out in rectilinear locomotion and stretch out and bask in a rectilinear position. And that is what he liked to do a lot. He liked to just stretch out lengthwise. And so we know from that, it made it easy to measure him that he's 6 feet long, just right on the dot. And he's weighed about 1,200 grams, give or take, while we've had him. He's always been a great eater, feeds regularly, and we've never had any issues with him. So back in March of 2019, Hank was out utilizing the exercise area. And as I said before, he's never been one to do a lot of climbing. He likes to get up somewhere and stretch out. But he decided to try to climb down a vertical wall. But he was climbing down the wall, and there was a Exoterra enclosure at the bottom with the screen top, and he touched that with his nose. And the only thing still attached to the climbing area was his tail was coiled around something, and he was hanging straight down. And it seemed to startle him, and he has not been housed in an enclosure with a screen, so I didn't know if the texture bothered him. But he started to look like he was trying to pull himself straight back up the wall, and he laterally flattened his body and contorted it, and was really straining his muscles. I thought to get back up the wall. So I started walking towards him to help him out a little bit, and he opened his mouth in a huge yawn, and something fell out of his mouth. So I walked over to see what it was, and it was some bloody mucus. It was like some clear, bubbly mucus with a spot of red blood in it. Well, clearly that's not normal. So I collect Hank and I put him back in his, first I check him over. I open his mouth, I check him over physically. I can't find anything wrong. I don't see any excessive salivation or bubbles in his mouth. And he seemed fine after that. So I put him back in his enclosure. I sterilize everything because, of course, now I'm worried about a respiratory infection or something. Clean everything up. I take a sample of the mucus that he expelled. I immediately email the veterinarian that I work with, and of course it had to be a Friday. She didn't think it was an emergency, neither did I, because he was acting normally now. And so on Monday, after the weekend, I got him into the veterinarian, where we did a radiographic study of his abdomen, his thorax, and we didn't find anything abnormal. Of course, the vet and I were thinking maybe he has a respiratory infection, maybe he has fluid in his lungs, he may have an enlarged heart, but his heart was normal size and there was no fluid in his lungs. And upon physical examination, she didn't find anything wrong with him. His mouth looked great, no excessive salivation, no bubbles, his color looked good. The only thing she found on physical exam was she thought he was a little bit underweight. And so she advised me, regardless of what else we found, to up his meal size and see if we could put a little weight on him. So we went ahead, because we didn't find anything on the x-ray films, and we did blood work for viral testing and a CBC, which is a complete blood count, and a chemistry panel. And then I had brought a fecal sample with me, and we checked that. And so the fecal sample was normal. There were no endoparasites. Physical exam, he didn't have any ectoparasites. His in-house lab work showed nothing unusual except that he had an extremely high white blood cell count and his lymphocytes were elevated. So he had an infection going on somewhere, and we were sent home with antibiotic and some pain management. He was sent home on injectable antibiotics, which is, this is what it looks like, Tazocef. It's ceftazidime, and it's been shown to be effective on reptiles and snakes. So we were giving that intramuscular injections every few days for over 2 weeks. When the viral testing got back, it was negative for everything. We had tested for nidovirus and a whole slew of other potential viral infections that he could have, and they were all negative. So the only thing at this point that we're seeing is a high white blood cell count, which indicated an infection, and he was getting medication for that. However, despite that, his activity level continued to decrease over the following weeks, and he started to just sit under his heat lamp. And move only between his hide under the heat lamp and on top of his hide under the heat lamp. And that concerned me. He was eating normally though. He typically eats about every 2 to 3 weeks, and he was taking every meal, eating medium rats, no problem. So his feeding response was normal. He was eating the prey items with no problem, and he was still at this point having normal fecal elimination and producing normal urates. So now we're going to fast forward a little bit to the end of May, beginning of June. He was barely moving around at all and just living under his heat lamp. Moved him to a longer enclosure. He was in sort of a not short, but 3-foot enclosure that was tall, and I thought that perhaps it would be better for him to be able to stretch out lengthwise, because that's what he always liked to do when he was loose. So I moved him into a shorter but long enclosure that he could stretch out in if he wanted to. And of course, because it was new, he moved around that the first night, but then he just went back to sitting under his heat. Around May 31st, June 1st, we did an outreach with him. That was here at the ranch at Spirit Keeper Equine Sanctuary. We had an equine biomechanics clinic going on, and some of the participants requested to see a snake, so I took him out, and he behaved normally during the outreach and was no problem. He was maybe out 15 or 20 minutes. I did notice that he had shed the night before and had a partial retained eye cap, which was unusual because his sheds had always been. The next day after the outreach, he was fed, which was June 2nd. So he was fed June 2nd, a medium rat. He ate it, no problem. His feeding response was normal, and then he just went back to basking. Now we're going to fast forward to June 19th. So we're over 2 weeks since he last ate, and he hasn't produced any feces, and he's produced a little bit of urates, but not too much. And I take him out to weigh him and potentially feed him again. However, I didn't find any feces in his enclosure, and he had a huge lump in his abdomen. So once I took him out and did a physical exam and weighed him, he'd gained weight, but his muscle tone looked poor. He looked like he'd lost muscle mass. I obviously did not try to feed him because I'm thinking at this point he hasn't passed his last meal. So I put him back in his enclosure, and a few hours later, I think it was about 2 in the morning, he just starts getting restless in his enclosure, stretching out in a rectilinear position and laterally flattening his body and just contorting it and opening his mouth really wide as if to yawn, but he looks like he's trying to swallow prey. His mouth is open and he's using his body and the muscles in his body to push as if he's trying to push prey that he's just consumed down to his stomach. And the lump that I had seen in his abdomen just keeps getting bigger and bigger. So now I'm concerned that he has an obstruction and he's trying to push his meal from over 2 weeks to go through, and he can't do it. And this went on for about 15 minutes. He rested a while, he did it again, and I'm now becoming very concerned and in planning to call the vet first thing in the morning and get him in. But I wanted to try to relieve his discomfort, so I gave him a warm bath, which he hated. For a coastal carpet python, he hates the water. He's never been a swimmer, a soaker. He doesn't even use his humidity box, so he was not happy that I was soaking him in warm water, and I was gently massaging his sides, and I could feel sort of a hard round mass in his abdomen along with something more squishy, and I could sort of hear things cracking, and I'm thinking part of that's a meal and part of it is possibly an obstruction. So after I soak him a few minutes, which was really more him getting out of the water and me putting him back in over and over, I put him back in his enclosure, and he did seem more comfortable, and the lump seemed a little bit smaller. So I don't know if things just moved around enough to give him a little bit of relief or what. But then about 9:30, 10 a.m. that same morning, he starts this contorting again. He starts laterally flattening his body like he's trying to push something down. He yawns and opens his mouth. But this time he regurgitates something. He regurgitated part of his last meal that now we're looking at 17, 18 days ago. He ate a medium rat and he regurgitated part of it. And it did not look very digested at all. It still looked pretty darn whole and like it just hadn't been breaking down. But after this, thankfully, he was much more comfortable and he just started resting peacefully. And we had made an appointment to get him into the vet the next day. We'd already done the radiographs and lab work. So this time we did a cytology. We did a needle aspirate of the mass that we felt in the abdomen, and that showed infectious cells. So then we did an ultrasound of his abdomen, and there was definitely a mass there. However, the veterinarian that I was seeing locally in Colorado Springs wasn't comfortable. She said that she would be willing to do an exploratory surgery, but that it would just be mainly practice for her, and she hadn't had very much success with anesthesia survival on the reptiles that she had worked with. And so she recommended a specialist up in the Denver area. I immediately called him, and they couldn't get us in for over a week. And I didn't want to wait that long, so they recommended somebody else at Critter Care Animal Hospital in Centennial, Colorado, which is between Colorado Springs and Denver. And she was fantastic, just absolutely fantastic. And I can't say enough good things about Critter Care Animal Hospital, really. They made an appointment to get me in the next day at 3 o'clock for a consult. And I emailed everything that we had already done over there to the hospital. All of my notes, all of his medical records, the ultrasound stills that we took, the x-ray films, everything. I, within an hour, got a call back from the doctor asking if I wanted to forego the consult and just schedule a surgery for the next morning. And I said, yes, absolutely. That's what I want to do. He's in distress. Something's clearly wrong. We've done everything we can do to diagnose it, and the only logical step, if we were not going to euthanize him, which we were not, was to do an exploratory surgery and see exactly what was going on in his abdomen. So I drove him up to Centennial. I talked with the doctor. We discussed that if she got into surgery and opened him up and it looked hopeless, like it was just something horrible that really made no sense to treat or remove, that she would euthanize him on the table, or that she would come out and let me know, and then we would make that decision to euthanize him on the table. And then if it looked like something that was within reason to treat or to remove, if it was like a cancerous tumor, that she would do that. And she thought the surgery would happen about 11 a.m. that morning, and I was gonna wait. So I took my van up there from the animal sanctuary, which is a big cargo van, and I can nap in the back, and I drive it all over. So I stayed up there, ate lunch, took a nap in my van. The surgery was supposed to be at 11. At almost 1 o'clock, I hadn't heard anything yet, so I go inside just to get an update, because my mom was texting me, my husband was texting me, asking, how's Hank doing? And I said, well, presumably he's still in surgery, or they'd contact me, they'd come out and let me know. So they said, yes, he's still in surgery. I go back to the van. About 15 minutes later, somebody comes out and says, she's getting ready to finish up. You can come in and watch. So I went in and was able to watch her, closing him up and finishing up the surgery. And she showed me this huge mass that she took out, a little bit bigger than a golf ball. And I couldn't believe my eyes that huge mass was in his abdomen. So after she finished the surgery, he was being attended to by a technician. His heart was being monitored. His blood pressure was being monitored. He was still intubated. She came out and talked with me. It was a mass between his esophagus and his stomach, and she took out just absolutely as much as she could. She took out some of the stomach tissue and some of the esophageal tissue, and she resected it back together and explained to me that the huge danger was dehiscence. That she had to stretch that so tight to get it put back together that there was a risk it would rip apart, and that was the biggest concern. I mean, other than him waking up from anesthesia. So it took about 3 hours for him to wake up. I stayed there with him, with the technician, with the doctor. We were able to leave the Doppler machine on him so that we could hear his heart beating, which made everyone feel better, because I'm telling you, when a snake is anesthetized or sedated, they look dead. They look just like they do when you find one deceased. So it's a little bit disconcerting, but with the Doppler machine on his heart, we were able to hear his heartbeats. And then after a while, we could see that he was breathing on his own, and his mouth started moving a little bit. So the intubation tube was removed, and finally the Doppler was removed. And then I was able to sit there with him and watch him breathing until he started moving around and woke up. Then they gave him his first dose of antibiotics and pain medication, and I was able to bring him home. We did send the mass off for histopathology, and unfortunately, about a week later, that came back as stomach cancer. Histopathology results weren't what we were hoping for, and the doctor had taken the largest margins that she possibly could and still leave enough stomach tissue and esophagus to reattach together. Histopathology showed was that the margins weren't clear, and what that means is, so if this is the tumor, the doctor removed all of the tumor, but then she also removed a little bit of the esophagus and a little bit of the stomach, and those are the margins. And what you hope is that those margins are free of any cancerous tissue, so that when they look at that tissue in the lab and they determine, yeah, this tumor's adenosarcoma, it's stomach cancer. It's a pretty rapidly growing type of cancer and can be very aggressive. But what you hope is that what you see in the margins is normal stomach and esophagus tissue that doesn't have the cancer spread to it. And unfortunately with Hank, we did not see that. The margins had cancer cells in it, a pretty high number of cancer cells. And so from that, we know that eventually this cancer is going to spread, or the tumor is going to come back. What we don't know is how long that's going to take. It could be 2 weeks, it could be 2 months, it could be 2 years. And until then, we're just going to keep Hank as comfortable as possible and give him the best quality of life possible. And as long as he's having more good days than bad, and he's able to eat and eliminate, then we'll keep taking care of him. So he is still on the injectable antibiotics right now, the Tazocef, or the ceftazidime, and he gets that injected intramuscularly or subcutaneously every 48 hours. Okay, and with him, less restraint is better.
Okay.
So
Okay, buddy.
let him settle for a minute. And I'm going to give this injection can be sub-Q or IM. And since he's quiet right there, I'm probably going to try to give it IM. And we're going to do it in the epaxial muscle underneath one of the scales. Okay, that's done. Good boy, I know. Okay, incision needs to stay down. Okay, so I think that all looks good. So let me go back. He's fine. And we want to make sure that doesn't brush against something like this. So that's why I held my hand under it while he went back in. And then he has Medicam for pain. And just a note about that, the Medicam is a non-steroidal anti-inflammatory drug, and it's a pain medication, and we've used it for our dogs, and they use it for people. What it says on Hank's medical report is, we don't really understand pain pathways in reptiles very well, but some reptile owners feel this does help. I didn't really like that very much, and I'm not blaming the veterinarian. And we have used the Medicam with Hank. We gave him 4 doses, and that has to be orally administered. And giving him the oral medication was just more distressful to him and bothered him more than the injections. And so after 4 days, I talked with the veterinarian, and she said, you know, we could discontinue it, and if he didn't seem any different, then we didn't have to keep giving it. But if it seemed to make a difference, we could give it as needed. But my point here is reading that the pain pathways of reptiles aren't very clearly understood is not what I, as a reptile owner in the 21st century, want to read on a report. And so to all of you out there that are young people that are just starting college, we need more people going into reptile medicine and biological research in reptile fields that are studying reptile biology and physiology and how medications affect them. And things like analgesics in reptiles and reptile cognition and behavior and neuroscience. I just really encourage you that if you love reptiles, go into a science field and do some research so that we can further along reptile science. Because I sure would want to give my snake medications that I knew for sure were going to help him feel better than one that might help him or might not. Where we're at now with Hank is he's in this enclosure that we had to really minimize. Because he's recovering from the surgery and he's supposed to stay quiet. So we had to take out anything that was for climbing or swimming or that would encourage a lot of activity and keep his enclosure to a bare minimum. So he has a hide on the cold side and a hide on the warm side and a small water dish in the middle, and that's it. And he has been drinking plenty of water. He's a good drinker, so that's great. And then as far as the substrate, we can't have anything that could get stuck to his incision or that he could rip his sutures on. So we just have pillowcases. That's what they were using at the veterinary hospital for the reptiles. And they were spaying a bearded dragon after Hank's surgery. And they clearly are knowledgeable about reptiles at Critter Care and other exotic animals, like some exotic mammals. They had a hedgehog in there that they were treating as well. And so they were using pillowcases in his recovery enclosure there, and that's what I'm using here at home. It's just smooth pillowcases, and that way we can see if he eliminates and he won't snag his incision on you. Now he isn't going to be happy. There he is under his hide, and he is feeling really well. He's active when I get him out. He doesn't like me messing with him. He doesn't like the injections, but he is bright and alert and active. Actually doing really well, and he's not even 2 weeks post-surgery yet. The next big step for him is going to be a meal. So around July 7th or so, we are going to try to feed him a very, very tiny meal. The vet said tiny, and I said, well, what do you mean tiny? And she said like a pinky, and I said, do you mean a pinky rat or a pinky mouse? And she said, just absolutely the smallest food item that we could feed him. Because we're not going to know if that incision, that internal incision, has dehisced or not, until we try to feed him and see if he's able to eat and if he's able to digest a meal and pass it through. And so I know he's a big, medium-sized snake, 1,300 grams, and a 6-foot carpet python, but she wants me to feed him a really, really, really small meal because we have to see if everything's working. I did find 2 scientific papers on the same condition that Hank has, the adenosarcoma. Tumor in the exact same place between the stomach and esophagus. So I will put the links to those papers in the description of this video if you'd like to check them out. And also coincidentally, both of them were carpet pythons. They were both diamond pythons, Morelius pilotus pilota, the nominate subspecies. And one of them died 12 hours post-surgery. So Hank's way past that. We are, 10 days post-surgery now, and he's more active every day. And he protests more each time I have to give him his injections, so that's all great. I'm happy about that. We'll just have to see what happens when he eats. The other paper talked about a carpet python that had the exact same surgery Hank did, where they had to resect and really stretch tissue. And that snake was doing well and eating 6 months post-surgery, and then there were no more updates. So unfortunately, I don't know the outcome, the long-term outcome of that case. That's what's going on with Hank. We hope that this gives him several months or a year or 2 to be with us and feel well, but we just don't know. So we have to really watch for any signs that that obstruction, that tumor is returning, or that the cancer is spreading to other organs. And I obviously monitor him very closely. I keep detailed records of what's going on with him, and the veterinarian is staying in contact with me. I really appreciate everyone's comments and remarks on Facebook. I've posted a few photos of Hank's whole ordeal on Facebook, and I've just had a really huge outpouring of people saying that their thoughts are with him, they hope he gets well, and they're interested in finding out the outcome. Several people wanted to know the histopathology results and just know what went on with the case, because anybody that's going to care probably has your own snakes. And so I've learned signs to watch for just going through this process with Hank. And I've learned lessons that discharge from the nose or mouth doesn't necessarily mean a respiratory infection, and it doesn't necessarily mean a virus, although it could. And we ruled all that out, and we just kept ruling things out until we got down to the root cause of the problem, which was unfortunately this stomach tumor, the stomach cancer that was growing between his stomach and esophagus. But I appreciate everyone's support and interest in his case, and I appreciate everyone's well wishes. And everyone, please just continue to wish Hank well. Thank you.